This program is designed to help those who are interested in complementary medicine to achieve a clearer understanding of the different types of treatments available today. Before a practitioner starts a treatment or gives a diagnosis, they will take a case history. The case history is very important to the practitioner, as it indicates the type of lifestyle that the patient has and will also alert the practitioner to any contraindications associated with the treatment. Contraindications are reasons why the treatment may not be right for the patient. For instance, homeopaths and herbalists are wary of giving ingested treatment to pregnant women. Complementary medicine focuses on the cause of the condition and not just the symptom. Practitioners will consider all the information available and will then form an opinion of the whole condition and its possible cause. The cause may not be apparent to the patient, as sometimes the symptoms may seem to have no bearing on the cause of the condition. As the basis of complementary medicine is to find the cause of the symptom, a patient may find that the first treatment is often the longest and could cost more due to the extra time that must be spent in order to come to an accurate conclusion. Further questions will be asked during future visits, and the patient's records will be updated accordingly. Complementary medicine works by triggering responses from the body to establish a natural balance. Occasionally, the patient may find that the treatment creates certain reactions. These reactions are not necessarily a bad sign and can indicate that the treatment is working. However, if a patient finds the symptoms uncomfortable or they are not happy with the treatment, they should contact the practitioner to discuss the problem. The practitioner may be qualified in other therapies and could recommend another treatment, or may refer the patient to another practitioner or doctor if necessary. Practitioners will also give advice that can be used to help the patient at home. It is also worth noting that complementary medicine practices have evolved and have changed through time, so two complementary practitioners may not use exactly the same methods. Disciplines can change depending on the school where the practitioner has trained and whether they involve other subjects within their treatment. The practitioner will have learned from his or her own experiences. The treatment will have evolved, and this knowledge will be passed on to the patient.
If I take you back to the actual construct of the word massage, actually means to knead, and it's a kneading process, as it were. So kneading, rather like as you move with bread, to knead bread, and it's a process. It's a process of doing it. So from that kneading process, if you like, what I'm doing is I'm actually manipulating the soft tissue of the body and actually relieving tension and fibres that actually exist physiologically in the structure of the body to allow that free flow of the system of the body which has been clogged up. Often termed as knotting. I try and understand actually what is causing the problem that's being presented. Could you tell me the sort of areas that you'd like to make me aware of today?
Yes, the main problem is an Achilles problem.
Right.
Which has been there for almost a year now.
With regards to you in yourself, this is a specific area on your right leg, but is there anything else with you that is affected?
I sometimes get quite a bit of tension across here, which I think is probably from work, work related, using a computer, and a fair bit of driving.
Right, so that almost seems like another area that we're going to be talking about.
Yes.
In appreciating that and then work on that area, which can actually be a distant area to what is initially presented. Evidently, if somebody's presenting with their calf muscle, often that relates directly to the calf muscle, but it might have strong indications to the way that we are joined together with sort of pelvic muscles, also the tendons that they have in the ankles and the lower part of their feet. So it's about actually solving the problem, and I have to sort of take into consideration anatomical knowledge to be able to provide that massage.
There are many different forms and techniques of holistic massage. Some methods will concentrate on a specific area, while others will address a wider problem and take into consideration the body as a whole and therefore work accordingly. For instance, stress-related conditions might require a gentle, flowing approach, whereas an injury-related problem may require a deeper massage.
We're very much unique and individual, and an experience such as massage can bring up certain effects for certain people at different times. People often feel very relaxed, almost expanded. They can feel tired, sore and stiff. It's a process of change that they're bringing about by having a massage, and that illustration of change is a good thing. Some people can actually receive headaches because of the toxins that are released before they're actually taken out of the system. But as I say, those changes are of benefit if we could consider healing as a process.